University in Worcester in 2012. And so I started working in primary care in 2013. And I've been working in primary care since then. I also moonlight in urgent care and emergency department. And then last year, I did a little bit of a career shift and joined MCPHS as faculty. So I've been primarily teaching for the last year and a half or so. I still work clinically, so I have 1 day a week in clinic in my primary care office, and then the other 4 days of the week I work at school. So it's a little bit different, but definitely easier for my family life. My school schedule is a lot more flexible, and so it's easier. I have 2 little kids, one going into 2nd grade and one going into preschool. So it's a little bit of crazy town around here most days. So my primary care office is part of an academic medical center in central Massachusetts. And we have a residency program. So we have 12 resident physicians. We also have 9 faculty physicians, 2 NPs, and another PA besides myself. So it's a pretty big office. We have about 8,000 patients. And we also have visiting specialists. So we have an orthopedist, cardiology team, a podiatrist. We have psychiatry that comes, and we have integrated behavioral health with psychologists and licensed clinical social worker. So it's really an amazing place to practice as a PA and as a physician also. So my clinic life is kind of crazy. We're pretty busy, so it's a little bit insane, but I love it because my patients are just wonderful. They're really wonderful people. And our patients don't like to go to the big city, which is about 30 miles away. So they really like to come to our office for everything. So we see a lot of urgent care visits, and we do manage a lot of chronic conditions and issues for patients because they want to get all their care there. So the day starts at 9 o'clock. We start seeing patients at 9 a.m. And then we have 2 sessions. So we see patients from 9 to 12, and then we have lunch from 12 to 1, which is not really lunch for us because I'm busy catching up on charts and doing notes and making phone calls. Then 3 days a week from 1 to 2 p.m., we have either a faculty meeting or an educational hour. And so different folks within the health center will present on an educational topic. So one couple Mondays of the month, we have a review of all of our obstetric patients who are currently pregnant and expecting. A couple Mondays of the month, we have review of all of our patients who are being treated for opioid addiction. And then we have different topics that get presented in that time as well. And then our afternoon session is from 2 p.m. until 5 p.m. And we also have evening clinic 2 days a week. So if you work evening clinic, your last patient would be around 6:15 or 6:30, depending on what you choose. So the day is really long some days, but we have a lot of different things going on within the health center, so it definitely goes by quickly. So during a regular session, I would see anybody with a family medicine practice. So we see newborns all the way up until the very elderly. My oldest patient was 102, and she's wonderful. So we really kind of do all the things. We do diabetes management, hypertension management, other chronic illnesses. We see people for urgent visits, physicals, well child visits, you name it, they come in for it. Our schedule is a 15-minute block schedule, so it's a little bit difficult sometimes to fit it all in. So every patient is booked for a 15-minute visit, regardless of what they are there for. So it gets to be a little bit hectic, but fortunately, we also work with scribes. So I have a trained scribe who comes and follows me around and takes notes during our visit and creates the notes for me. So it's sort of one less thing to do, which is wonderful. And we also have a full staff of registered nurses, as well as a couple LPNs and medical assistants, certified medical assistants, who help us manage all of the vaccine administrations and different testing, and the flow through the clinic is their responsibility. And they also do lots of patient outreach and phone calls and managing labs and requests from patients and all of that stuff. So it's pretty excellent. I've been in my office that I was just telling you about since 2014. And it was a tough choice to leave to sort of switch to the academic world, but it was the right time for our family. So that's sort of how I ended up there. I see a question: would you allow a student looking to become a PA shadow you? I would love that. Unfortunately, the institution, which my health center is affiliated, does not allow shadowing from outside facilities. So it's an academic institution. We have a medical school as well as a graduate nursing program. And so the logistics of having someone come in to shadow is difficult, unfortunately. It's something that I'm always sort of working on in the background, because I think it's really important. Where we have such a robust practice, it's a great place for a PA to work, and it's a great place for people to see what a PA does and how a PA can really function autonomously in primary care. So it's something that I really am working on, but at this time we can't have anybody shadowing. So does anybody have questions about sort of clinic life? What made you want to work for your school rather than another type of clinic or specialty? So I really like academics, and I like academic medicine, having been exposed to it through my office. And unfortunately, the academic institution affiliated with my clinic doesn't have it. There's not really a lot of opportunity to do teaching within the medical school as a PA. And so I had always planned to sort of get into education at some point. And the time just kind of was right. My husband had finished PA school, so he's a PA also, and had started working, and sort of my daughter was settling into kindergarten. And so the opportunity came up, and I applied and got the job, and so here we are. And so when I work at school, the day starts around 8:30 and ends around 4:30, and we have a lot more flexibility with the time management of the day. We have meetings throughout the day, and lecture responsibility to be in the lab setting, teaching the PA students physical exam skills and procedural skills. So I really enjoy that, but it's really nice to have a little bit more ownership over my time during the day. Did you have your little one prior to attending PA school? If so, how did you manage? I actually was pregnant during my clinical year. I got pregnant about halfway through. So I didn't have any kids while I was in PA school. I cannot imagine having children while in PA school. It's a lot. You've got to have a really good support system, and really figure out how to best compartmentalize your time so that you can be there for your family when you need to be, but still focus on your schooling. I think it's helpful to remember that if your kids are really little, like under 5, they're not really going to remember that you were super busy for a couple of years, and it's definitely going to make your, advancing your career to that next step is going to be great for your family in the long run. So I try to think about it that way for those who have little ones. My husband was in PA school while we had kids, so my youngest was born just about a third of the way through his first year of school. So that was a little bit stressful, but we have parents and family who help out, and I was still working, so it was okay in that way. How many hours did I work per week when in the clinic setting? So I was a 0.8, which means I had 32 hours of clinic time per week. So 4 days, essentially. We, as part of our compensation are given administrative shifts or administrative sessions. So I would have time to be able to sort of catch up on notes and phone calls, and all of that was sort of built into the schedule. So I had one admin session a week in which I didn't have any patients scheduled. So that was nice to be able to have some time to catch up. What are some differences you see at an academic institution versus other PA settings? I think it's a very different feel because the focus is always on teaching, because there are resident physicians and other learners within the health center. I love it because it really, you get to teach in a clinical setting, and really help people put the pieces together, which is my favorite part, I think, about teaching. And to really have that focus and have people always thinking about, I think you get to a point in medicine where you sort of have, problem answer in your brain, but to be able to step back and think about the pathophysiology, think about the mechanisms behind why the medications work. It's nice to be able to take that step back and help people who are learning put it all together. Would PAs be able to open? I think this already got answered. You cannot open your own private practice. There's sort of a shift to have optimum team practice right now. That's sort of been talked about in lots of different settings, but as of right now, I would say, I think in all states, you do need to have a supervising physician. What that supervisory agreement looks like depends on your institution and your state. What's it like juggling a PA work and being a mom? It's crazy. There's no other way to really describe it, which is a challenge, but I do love it. And I love that my kids, I have a daughter and a son, I love that my kids can see me doing something that I love and being productive and helping people. I think that's really important as a parent. So in that way, I don't mind. And definitely having the most of my week being in education, being in the academic setting, it definitely makes things a lot easier for family life. Are there nurse practitioners in my practice? Yes, so we have 2 nurse practitioners. In the day-to-day practice, it doesn't really make any difference at all. We see the same patients, we manage the same things, we're treated the same way in terms of what we can do in clinic. There are some logistical things that are a little bit different, but my institution sort of treats NPs and PAs in the same way. And so we really all are sort of in the same boat. Let's see. Do you feel like my life is consumed by my career? Sometimes. It's challenging, particularly in primary care, because the problems never go away, right? Your patients, you see your same patients all the time, which I love. I love that continuity and being able to get to know people and being a big part of their life. But at the same time, it's like the work never ends. There's always more stuff to do. So for me, the first couple of years in my practice, I felt the need to sort of put in that extra time. And I had one child who was small and we had some help. So it was okay. But then once I had my son, I really sort of pulled back a little bit and decided that, I would stay at the office until 6 o'clock and then I would go home and that was it. I didn't do work at home. I didn't do charts at home. I purposefully left my home life very separate from my clinic life and my work life, because that's just the way that it worked for me. That's not to say that like every once in a while I would catch up on charts at home, but for the most part, I don't do clinic work at home. How do you manage your time to do other things? That's sort of how I manage it. And not everybody works that way. And some people sort of do just fine with having everything overlapping. But for me, it was important to make that switch. Let's see. At what point do you choose to specialize? You can choose whatever field you want to work in when you get your first job. So you don't have to choose at any point during school, but you can decide when you're looking for jobs what you want to do. Let's see. So behavioral health patients, what's the average management needs specific to the different populations? So we treat a lot of children with ADD and ADHD. We treat a lot of mood disorders and some of the more significant psychiatric issues like bipolar disorder. We're lucky to have a psychiatrist who comes and will see our patients in consultation to help give guidance on treatment plans, which is really excellent. We also have integrated behavioral health, so they can get their counseling appointment and then see one of the providers to sort of follow up on any medications and stuff like that. So although our schedule is 15 minutes, we can book patients for longer. So if a patient needs 30 minutes, then they can have a 30-minute appointment. But routine is really just 15 minutes. Do you think it's wrong or frowned upon to take a gap year or months between graduating college and gaining patient care experience? I guess it depends on what you're doing during that gap year. If you're, having some sort of abroad volunteering experience or doing research, or it depends on what you're doing during that time. And I think most people are understanding also if you've got like family stuff going on or other things that just are more of a priority. I think most people think that's okay. I do have opportunity to do research. So part of my requirement at school is to do scholarship. And so that can be original research or working on publications, or, there's lots of different ways to satisfy that requirement. But in the health center, I also participate in quality improvement efforts. And so we can sort of do little miniature research projects, if you will, in order to help improve the flow of patients through our clinic and just sort of practice workflows in general. But we also have several physicians who are excellent at obtaining grants. And so currently right now I'm working with one of our physicians on a grant related to patient safety and improving patient safety. So in the last year, we held workshops for all of our staff around high priority patient situations, but we also included work around communication and being effective team members. And so there's lots of different ways that I've been able to get into research and scholarship in more than one setting. How did I help pay for school? The government. I took out loans for everything. And so it's a tough pill to swallow when you have to sign your life away for that much money, but in the end, it was most definitely worth it. What's my favorite part about the PA profession? I love that as a PA, I can sort of be in any situation and feel like I could do okay. During the beginning of the pandemic crisis, the family medicine department helped to staff a triage tent in the emergency room or outside the emergency room at the hospital where my clinic is affiliated. And so to be able to have that sort of skill set, that basic skill set to just jump in and help was awesome. I also love building relationships with my patients and helping them through difficult times. I think being there for somebody in that way is really an honor, for people to share their difficulties with you and share parts of their history, medical history or social history that are really private to them is really quite an honor. And I love building those relationships with patients. I think the PAs are in a great spot right now as healthcare is changing. And I think that we as a profession are definitely going to experience some growth in the next 5-10 years as healthcare changes. Any tips for an excellent personal statement? I think it's really important to have a statement that is unique and that shows who you are, right? Like that's the point of having the personal statement, is to let us know, or let the whoever's reading it know who you are, because we can read about your GPA and we can read about your accomplishments and see all of that stuff in your in your application, but to get a sense of your personality or your morals or values or your work ethic through your personal statement, that's what I really look for when I'm reading them, to see if I can figure out who this person is and what they're all about. Is it hard to separate in terms of getting work done in the office and while you are working? I'm not sure I really understand your question. It's difficult to get everything done in the, in my clinic office in one day. It's rare that I would leave at the end of the day and have everything buttoned up. But again, I made that choice to really separate my work and home life, and I think that's important for people to do. Now that everybody is working from home, so this is my home office, which is difficult when my kids are home, but they're at camp today, thank goodness. So it can be difficult to have that separation now, especially because the office is right here. So I think lots of people are feeling that, and hopefully, in the next several months, we'll be able to get back to going into the office. Have there been any big shifts in a PA's scope of practice since I first started? So we can sign death certificates now. We weren't able to sign death certificates when I first started. The visiting nurse orders for patients who have visiting nurses in their home, we're allowed to sign those now, which we weren't before. But otherwise, things are relatively the same in terms of those kind of administrative things. We are able to prescribe Suboxone or buprenorphine for medication-assisted treatment for opioid addiction, which was huge. So it requires a little bit of education. So you have to do an online or live course and then apply through the DEA. But I was able to get my license to prescribe Suboxone, so I can work with patients who have opioid addiction. So that's a big difference. I'm trying to think if there are any others. Nicole, I think you're in here monitoring the chat if you know any that I didn't mention. Any volunteering opportunities I would recommend specifically for PA? I think it's helpful to do volunteer work that's meaningful for you. I'll say that. I think we're just about out of time. I'm sorry I can't get to all of your questions, but I'll stay in here and answer some of them so that we can move on to the next presentation. I really appreciate your guys' time and all of your questions and interest. If you want to email me or have any specific questions, you can get in touch through my email. I'll put it in the chat here so that you can reach out if you need to. So thanks very much.